Hey everybody, Dan here with Pain Free You. I really intended to go outside and shoot a video today, but before I knew it, I turned around and looked outside and it was dark at 4:30. So, indoors we are again. Today I want to talk about trust. So, I'll get to that in a second. Take a couple of breaths with me. Breathe in the trust. Exhale the distrust. Breathe in the clarity. Exhale the uncertainty. Breathe in the peace. Exhale the noise and the chaos. So trust. The heck am I talking about? Well, in the past week, I've probably told at least 3, maybe 4 individual coaching clients to trust their body. The body knows what to do. We, meaning we and our brain, don't need to be involved, right? If you cut yourself in the kitchen, do you need to be involved in the healing process other than washing it out, maybe putting a Band-Aid on it, or maybe a little, antibiotic ointment on it? That's it. Trust the body. It knows what to do. The body does heal, right? I'll tell the story again, and I know I've shared it before, but I've got a buddy who's about 50 years old. He's been riding dirt bike, motocross, motorcycles since he was 4, competitively. Meaning he gets on that thing and he goes as fast as he can, the bike jumps as high as he can, and he's crashed probably thousands of times, and he's broken hundreds of bones. And he always heals, and he has no chronic pain. So why does he have that result? And one of us can have pain come out of nowhere, and it lasts for, years. Difference is he trusts his body to heal. Right? Many of us don't believe that we can heal. Many of us don't believe that we will ever get well. Many of us fear and catastrophize a lifetime of chronic symptoms and pain. Somehow we've forgotten to trust our bodies. Right? I will tell you that things like chronic pain or other chronic symptoms, illnesses, gastrointestinal problems, even autoimmune stuff, can kind of get stuck in the on position when the brain gets too involved and we stop trusting. And so it's really, really important to just recognize how absolutely unbelievably amazing the human body is. When you factor in everything that the human body can do without our involvement, everything from respiratory to vascular to digestion to immunity, muscles, our ability to do virtually anything. It's a miracle. We can literally, grow a baby inside of us. Right? Not us, meaning me, but inside of a woman. And it's absolutely a miracle that 2 cells can come together, and out of that can come a full-grown human being. First an infant, but that baby gets old and grows. Absolutely amazing, a miracle. And yet, for some reason, we'll have symptoms, and we've lost our trust in the human body. We've now come to fear our human body. We've come to fear our own brain. This mind-body process, this TMS, this perceived danger pain does not mean you're mentally ill or emotionally damaged. It just means your brain is perceiving danger. And until we teach the brain that we're really not in danger, physically, emotionally, mentally, it's likely going to stay in the on position and keep these pains or symptoms going. We need to get the thinking brain out of the process and trust. I know that sounds easier said than done. It probably is, easier said than done. But at the end of the day, we're not designed to be in pain all the time. The body does heal. If we trust it, it will. Now let's back up. That doesn't mean that TMS means your body needs to heal, right? Any previous injuries or surgeries or illnesses have likely already healed. If there's any remaining symptoms, they have become learned or conditioned responses. Let's go back. TMS means you're not broken in the first place, right? You're not broken. There's nothing to fix. There's nothing to heal. It's completely different than that example of cutting your finger. Because in that case, there is something to heal. But we don't have to be involved. We just simply wash it up, bandage it, leave it alone, and a few days later, look at that. It's grown back together. When you break an arm or a leg, do you have to be actively involved in the healing process? No. You go to the hospital, doctor, they put a cast on it, stability boot, splint, whatever, and then you essentially rest it and forget about it. The body does the rest. So if you do have any true injuries, please do not add into the complexity fear and attention on this true injury and cause it to perhaps have the pain stick around longer than it should. So trust. But as it relates to TMS and the mind-body process and this perceived danger pain, I'm going to really encourage you to teach your brain to trust that you're not in danger. Because as long as you're running around freaking out, you're teaching the brain the opposite. You're teaching your brain, oh my God, we're in trouble. So I really think it's important to just trust that your body and even your brain knows what to do if you give it the right information, which is, it's okay, I'm good. I'm not in danger. Everything is fine. What's the best way to calm down the brain and the nervous system in pain or symptoms? Is to actually be calm. When you do that consistently, the brain eventually learns. They're doing pretty well. Look at that. And so we have to trust our innate ability to be well. That's how we're supposed to be. And so try to get the thinking brain out of the mix. Yes, we may want to use the thinking brain to interpret when it's going offline and we're catastrophizing and freaking out a little bit, and use the thinking brain to remind ourselves that we're okay. But I'm going to encourage you to trust that with enough consistent messages of safety, your brain will eventually get the message and eventually dial down the sensitivity of the brain and the nervous system. And once that happens, trust that the pain will let go. When the brain is no longer afraid, or in some cases terrified of what's going on, it will dial down the symptoms and eventually they'll fade away. You don't need to be involved. Trust. So that's what I got for you tonight. Hope everybody is doing well. Love you guys and gals, and I'll talk to you tomorrow.